Diagnosis of allergic rhinitis. The history of the patient make the diagnosis clear due to runny and stuffy nose, watering of the eye, congestion of the eye, injection of the eye due to conjunctivitis. There is also nasal drip and also the disturbances in the hearing and the visionary process due to blockage of the nasolacrimal duct and the gutational tube by the overproduction of the mucus. Now the lab tests are consisting of blood examination for detection of the antibodies, that is IgE, in the blood produced by the immune system of the patient against the particular allergens. There is elevation of the ESR and eosinophil count in the blood. Next is the prick skin test and the patch skin test. That is the various expected allergens in solution form. They are applied to the skin or injected in the subcutaneous area to detect the reaction against the allergen by the immune system of the patient. There is veil formation and the erythema at the site of injection. So these two tests, prick skin test and the patch skin test, are performed in the skin of the forearm and the back of the chest in the laboratory. Various solutions of the allergens are used to detect the expected allergens producing allergic rhinitis in the patient. Now the treatment of the allergic rhinitis. The basic step is to block the action of the histamine or the production of the histamine by the mast cell. So antihistaminic drugs are used: cetirizine, levocetirizine, loratadine. These medicine in the form of oral, tablet or syrup forms, or also in the shots, can be given to the patient suffering from the allergic rhinitis. Second line of treatment is decongestion. That is to reduce the overproduction of the mucus by the goblet cell lining the mucosa lining the nasal cavity and the back of the pharynx. So reduce the overproduction of the mucus, which produces obstruction in respiratory tract. I mean the upper respiratory tract, I mean the nasal passage and the back of the pharynx. So entry of the air consisting of fresh oxygen is enhanced by these medicines. So decongestant, limin, phenylephrine and pseudoephedrine and phenylephrine. These medicines, they are used as the decongestant medicine. Next we have to do, that is the nicotine inhibitors. That is Montelukast. These medicines, they are also beneficial for the treatment of the allergic rhinitis. So these are the various medical treatment, and these medical treatments are mostly and usually used as nasal spray, inhaler form, that are mostly used in addition to the oral form. In addition to this medicine, to reduce the inflammation and irritation, we can also administer corticosteroids or the steroid medicine in oral form, in short form, and also in the inhaler or the spray form. in the nasal cavity. The general hygiene is that is the rinsing and washing of the nasal cavity by the saline water. Frequent, so that the allergen which is getting entry, they must be kicked away or washed out of the nasal cavity. And the domestic or the primary preventive measure is that you can apply olive oil or glycerine, Vaseline in the start of the nasal tract in the nostrils. So the allergens in the air, they should stick at the start of the nasal cavity and maybe should be washed by the frequent rinsing of the nose and blowing of the nose. So these are the various preventive steps to avoid the entry of the allergens producing the allergic rhinitis. Then is the basic preventive measure is that you follow the hygiene hypothesis. Use of mask, use of gloves. Then you should avoid during the spring season to visit the gardens where there are flowers producing the pollens and producing the spring allergy. Then if you are dealing the pets, animals, then you should use mask and the gloves. And frequent washing of the hand with soap water is essential and the basic factor in the hygienic hypothesis. Change of the atmosphere, that you should live in neat and clean environment. Your house should be sunny. Fresh air must get access in your rooms, especially the sun rays are essential to kill the various bacteria, and also the cleanliness of your rooms from the dust, so that these mite and ticks and dandruffs should be cleaned away out of your residing rooms. Now the latest progress in prevention of the rhinitis, allergic rhinitis, is the vaccination. This is called as the immunotherapy. That is the desensitization of the patient by the frequent increase in the quantity of the allergens. In solution for these are the injections. Vaccine is given by subcutaneous injection from smaller doses to higher doses gradually and insidiously, so that the patient, immune system of the patient should not attack immediately to the entry of the expected or the attacking allergens, which produce person's allergic rhinitis. So by this vaccination, we train the immune system that should be friendly with the allergen getting entry in the body of the patient. So this is a gradual increase in the concentration or the quantity of the allergen which is suspected to be causative factor. So this is called as the desensitization of the allergic system in the patient. So these are the basic factors which are produced to avoid this disturbing ailment, and the person activity must be restored to treat this allergic rhinitis by these medical as well as the preventive measures.